Hello, my name is Lauren Dawson, and this is my patient education video for the medication lithium treating postpartum psychosis. Postpartum psychosis is the rapid onset of significant psychotic symptoms such as delusions or hallucinations, bizarre behavior, confusion or disorganization which may appear as overall delirium. The priority in treatment is to ensure safety for both the mother and the child. Postpartum psychosis is rare, affecting only 1 or 2 women out of every 1,000 births within the first 2 weeks from delivery. The causes of postpartum psychosis are not well understood and may be due to the abrupt shift in hormones or possibly triggered by conditions related to obstetrical complications. Sleep deprivation or increased environmental stress also contribute to the factors of illness and possibly to the thoughts of harm to self or to child. Something that I learned that is important is that there is no single DSM-4 classification for postpartum psychosis. Rather, it is seen as a severe form of major depression or as the onset or reoccurrence of a primary psychotic disorder. Among patients who develop postpartum psychosis immediately after childbirth, 72 to 88% have bipolar illness or schizoaffective disorder, and 12% have underlying schizophrenia. The next part of my video is my patient education. The most effective treatment for postpartum psychosis is a combination of therapy and medication. The objective of medication management is not only finding what medication works best, but one at its lowest dose so the side effects are minimized. Postpartum psychosis improves thinking and reduces the risks of chronic depression in the future. Treatment of postpartum psychosis is 2/3 coping skills and 1/3 medication management to jumpstart your recovery. I'm happy to see here today that your husband is part of your discharge education, as he has also been a part of some of the family group therapy. And I'll tell you that family is a key role in recovery, as the valued education and skills that come with the education help support you in your health journey and help to support the compliance, not only with medication, but with participating in your outpatient group therapy. Your outpatient group therapy may be one of the most important steps towards recovery, being among others that share similar experiences, others that can better understand, and so you don't feel alone in this condition. Also supports compliance with therapy. Antipsychotic medications are the first-line treatment for psychosis and agitation in postpartum psychosis, and mood stabilizers reduce the risk of relapse. The most common mood stabilizer is the medication that you are being discharged with today, and that is a lithium. I've come to understand that you've chosen not to breastfeed, which is, on behalf of taking lithium, a good thing because it does pass through to breast milk, but I do understand that you've chosen to use a supplemental nursing system so you can still experience the nursing bonding, but with giving formula, so there is the best of both worlds. Your postpartum psychosis medication therapy has started with lorazepam and olanzapine, and now at this point you're adding in lithium, which is the medication we're going to discuss and better understand today. It may take about 5 to 7 days for you to feel any effect from the lithium prescription, and about 10 to 21 days for you to feel the full effect. You are going home on a starting dose of 300 milligrams, taking that 3 times a day. And after that, it'll depend on your lithium serum levels, which we'll talk about further. Some of the common side effects of lithium include fatigue, headache, abdominal pain, possibly nausea and vomiting, so it is important to take with food or milk so you can have decreased risk factors of abdominal pain or nausea. Also increased thirst and urination, and possibly tremors during the first few weeks. This is why it's very important to avoid driving and being alone with the baby until you understand how you'll respond to lithium. It is possible to experience lithium toxicity. It is a very sensitive medication, but a very beneficial medication. And some of those symptoms that you need to report immediately would be those of muscle weakness, slurred speech, decreased coordination, drowsiness, twitching, seizure activity, or irregular heartbeat called arrhythmia. There's also some effects on the kidneys and thyroid, so we're going to have a home nurse come to you in about 5 days to collect that first lithium serum level, and then you're reporting back here to the office in 2 weeks to not only do your next lithium serum level, but to discuss birth control, and then it'll be checked about every 3 months, so we know that you are receiving the therapeutic dose of lithium. It is important to talk about your over-the-counter medications and herbal supplements with your provider. The most common things at home that you need to avoid are your NSAID classifications of medications such as aspirin, ibuprofen, or Aleve. Psyllium, which is part of your stool softener classification, and caffeine all decrease the efficacy of lithium. It is also important that you don't suddenly change the amount of sodium in your diet because that will increase the rate of lithium leaving your body. In part of your discharge planning, you are keeping a journal of your recovery as well as your monitoring your intake and output. It's very important that you have between 2,000 and 3,000 milliliters of fluids each day, primarily water or electrolyte drinks, and we will be monitoring your weight throughout every 3-month time. Not drinking enough fluids may cause a lithium level to rise, and you may need more liquids during the hotter weather or while you exercise during your postpartum recovery as well. If you sweat too heavily, those fluids need to be replaced. It is normal to lack overall confidence with mothering after postpartum psychosis. Remember, most new mothers, not even with an illness, also feel this way. Some mothers have difficulty bonding with their babies after an episode of postpartum psychosis, and this can be very distressing. But it usually doesn't take long to recover and to have a full bonding relationship and a good relationship with your child. It can take 6 to 12 months or more to recover fully from postpartum psychosis. The most severe symptoms tend to only last 2 to 12 weeks. And after postpartum psychosis, you may feel depressed or anxious. It can take time to come to terms with what has happened. I understand that your husband has taken so many great pictures and videos of baby, and I know that he can't wait to share with you some of these memories that he's already made and share those experiences with you at home. It's normal to feel some sadness for missing out on these parts of early motherhood. It'll take some time to rebuild confidence in relationships and friendships, but most women do get back that feeling to their usual selves again. It's very important that you take your medication as directed, even when you're feeling well. A missed dose can be taken as long as it's not within 2 hours of taking your next dose. Do you have any questions? Okay, that's a good question. Yes, there are increased risks of postpartum psychosis happening again in future pregnancies, but it's not a promise. It'll be important as you recover fully to consider contraception, and I understand that when you come back in 2 weeks for your full postpartum visit that you'll be initiating some postpartum choices during that time. Any other questions? That is another good question. Yes, weight gain can be attributed to taking lithium, and during this postpartum time, it's hard not to want to get in shape and be mindful of your physical recovery as well. So it's important just to eat real food from the earth, from an animal, identifiable foods that hold good calories and good nutritional value. You'll really gain the right amount of weight if you listen to your body and you listen to what needs your body has, and drinking, of course, non-caloric drinks, limiting soda and fast food will also help in not gaining too much weight with medication. But overall, the benefits of this medication are great, and your recovery is going to be such a wonderful journey that I can't wait to see you succeed in.